we are already in 2020. And we must question how far are we going in this change, in this sustainable change. For instance, we know that during the lockdowns in Europe, air pollution decreased. But we also know that as lockdowns eased, air pollution is started to rise again. So, where are we at right now? Perhaps I don't need any more words to describe our current situation. Challenges. Perhaps all this comes down to challenges. A challenge is an invitation or a suggestion to somebody. An invitation might be a new or a difficult task that tests somebody's ability and skills. Or it might be a statement or an action that shows that somebody refuses to accept something and questions whether it is right, legal, and so on. So, I want to challenge you. I want to make you an invitation to think about a difficult task that tests our ability to accept that probably we are refusing to accept a difficult reality. This difficult reality was stated by the United Nations by 2015, when the Millennium Development Goals ended, and this preceded the Sustainable Development Goals program. And the conclusions are that we are facing persistent inequalities in the world that is affecting different parts of the world, that is affecting different social groups, women, children, people living in poverty, and that air pollution is likely to grow in the coming future. So, what we can learn from the past? We can learn that changes are difficult to implement, but perhaps more importantly, to make changes sustainable is even harder. And the world is watching, and I'm not sure whether we have many opportunities in our future to make change to happen. So, my goal today is not to address the Sustainable Development Goals themselves, is to reflect on how global health as an overarching concept help us to address the challenges that we face to deal with this sustainable change. Global health, I will not take too much time to discuss this. It has a focus on population needs and prevention of diseases. And it gives us a systemic understanding of health-related issues. So we know that our well-being is surrounded by many factors that are simultaneously causes and consequences that are placed in the micro and macro level. These key principles can turn into a five-dimensions framework that shows that health issues transcend national borders, that we need international cooperation, that we need a comprehensive view of individual well-being, that we must improve healthcare access, and we must have transdisciplinary actions and perspectives of complex problems. In terms of the geographical scope, one clear and very straightforward challenge is zoonotic transmission. We know that zoonoses are responsible for a large proportion of infections and that they are related to sanitary conditions, to poor sanitary conditions in livestock markets, and this was also visible in other epidemics in the past. And we know how far we are from reaching good results in this respect. But another challenge is to understand why zoonoses are so persistent. For instance, in Asia, Africa. One thing to look at is we are making a huge pressure on animals, on animal protein. So there are more people living in the world, and this amount of people is eating more or less the same thing. Not sure, this is a world map, and we can see some transactions, global transactions of live animals. And the point is that we understand that the way to cope with the growing demand for animal protein is by the industrialization of by the industrialization process. The point is that this industrialization is clustered around the world. So the production of live animals is segmented in different parts of the world, and this made that in 2017, almost 2 billion pigs, cattle, sheep, and chicken were that travel around the world. And we also know that the key problem that explains persistent zoonoses is that there is lack of strategic planning to place these facilities. In terms of international cooperation, there is a huge discussion about whether China gave us the right information in the right time. I will not obviously make a statement about this, just highlighting this point, and also that these issues are being more present in academic research right now. Apparently, SARS-CoV-2 was already among us in Europe in December 2019. But my point is that these kind of issues show the extent to which international cooperation is shaped by distrust. Linked to distrust is lack of transparency, and this lack of transparency is present in clinical research, for instance, in the vaccines, in the trials for the vaccine. But also in political action. In many countries, there is lack of understanding what politicians are doing and why. Also important to understand international cooperation is selfishness. I had a problem to find a right word to describe this. Because when you have one single country trying to secure the world's stock of one drug, one specific drug, this means something. And also, when we heard about vaccine hoarding, a vaccine that doesn't even exist right now, and we already know that many parts of the world will not have access to this vaccine. So, selfishness. And lack of understanding, because this completely disregards how diseases spread around the world. Also, geopolitical power. In this map, you can see the dots in the map are the locations or the main manufacturers and pharmaceutical companies that are at the stage 2 and 3 of the clinical trials of the vaccine for COVID-19. The point is the extent to which these locations will give us a fair access to the vaccine. This is the incidence of death related to COVID-19. So the point is that probably the dots in the two maps do not match. But also research. According to Dr. Collins from the National Institutes of Health, we need to come together and to work together to find a common solution for this problem. However, neither this was true before the pandemics, with the centrality of the US in the world research, neither it is today after the pandemics. We know today, in the last couple of months, that there is a reduction in international cooperation in terms of research. Also, that there is a bilateral dominance between China and the US. And this is reinforcing what I call it academic peripheries. So countries whose voice are not heard in the international stage. But also important to understand is an implication to transdisciplinarity in the sense that we know that research teams are now smaller and they've become again more disciplinary based. So how can we address complex problems if we are going back in old solutions? Comprehensive view of individual well-being. My point here is simple. We all know about individual preventive measures. I just made one. My point is that these kind of solutions, interventions, somehow are disregarding something that we know for more than 1 century, which are the social determinants of health. And social determinants of health are present also in COVID. So, when we want to address individual preventive measures, we should ask whether they are available, whether they are affordable, whether they are important compared to other living conditions and problems, whether people can avoid risk factors, and how people can cope with job insecurity and stay on quarantine or isolation for 14 days or 10 days, whatever, if they deal with job insecurity and low salaries. In terms of healthcare access, recent evidence shows that around the world there are many problems in healthcare access, both in developed and developing countries. For instance, in the US, almost half of the population declared that in the last month they were not able to find, to seek for health care or had a delayed access to health care. This is mainly true for dental services, hospital admissions. On the other hand, people are seeking more drugs. This is a clear connection with mental health, obviously. But also, important screening programs like cancer were reduced by 90%. Not 19, 90%. So probably one direct outcome of this is the rise of excessive mortality. These graphs report to Southern Europe, but the point is that this is more or less happening in the world. And these results were during the first wave, and we are reaching the second wave. Let's see how it happens. But the point is that low healthcare access will have an impact. But the point also is that what is shown and what is allow us to understand that we were not prepared to handle this situation. Obviously, solutions need to be country-based. But my point is that we should take the lessons and we should properly assess the different policy decisions that are being made. So, we need to know what is working well, for whom, why, and how it can be scaled. Currently, we have little evidence on these questions. So, and these are 3 simple examples of the kind of answers that we need right now to prepare ourselves for the next epidemics. And I believe that you all understand that the next epidemics is just around the corner. So, to end my presentation, reflecting on challenges that a global health perspective gives us, how can we move forward? I will bring just 5 highlights. One is that we need more money. It's not only a matter of throwing money to the problems, but actually we need more money to address the Sustainable Development Goals. And this is a consensual point around the world. Also, we need to better align national health policies and data sharing. This was a problem in the beginning of these pandemics, and it is still a problem today. In order to better prepare ourselves for epidemics and pandemics, outbreaks in general, first of all, we need to ensure universal health coverage. We also need to have proper training for our workforce. And also, we need to improve our data to better monitor what is going on. Given that epidemics are not unexpected events, we need to put in practice a comprehensive and ecological perspective of health and well-being. We know what must be done. It is only a matter of taking the right actions. And my last point might be controversial, but science must do politics in the sense that we live in times of misinformation and fake news. So scientists are the ones who have the voice, not only to inform policymakers about the truth and lies, but also to inform the public about what is being said and what should not be said in public. Thank you so much for your attention.